In the situation of the Burma cyclone, there was all this component of access. Could you tell a little bit about how you plan for such contingencies that are not expected at times? So thinking more in terms of the process of providing aid or helping these countries. Can you tell us some of the challenges, other contingencies that you face?
OFDA has an annual budget of about $800 to $900 million, of which anywhere from $150 million to $200 million at the beginning of the year sits in the Director's Fund. These are immediate, flexible funding in response to unexpected emergencies like disasters, like the cyclone, like earthquakes. So in the first place, we want to make sure that there's adequate funding available to be able to respond. Second, we actively engage with partners at the field level on a regular basis to make sure that if there are highly prone areas where we know there are hurricanes that are going to come in, for example, in Nicaragua and Honduras, we pre-position assets there, plastic sheeting, water, food. And we also have preparedness grants with partners at the field level so that when that disaster occurs on an annual basis, they already have the funding in place to be able to mobilize and get their logistics and get their support in place in the first 24 to 72-hour window. So there's a lot of preparedness activities that already are planned for this. In the context of Burma, because we didn't have access, because there were not the type of open access to the international community and there weren't many partners, it added that real difficult challenge because we didn't know what was happening at the field level. We heard anecdotal reports that hundreds of millions of people, perhaps 1 million people had perished. It's difficult, obviously, in an emergency setting. The key here is to make sure to understand what the logistics infrastructure is. But when you don't have access, when you don't have a government counterpart that is open and is transparent, how do you get supplies in? How do you make sure that you get the right people in country? So for Burma, we spent pretty much the first week, we lost the first week in terms of negotiating access, whereby in another response, if we did have that friendly relation, if we had partners at the field level, we could perhaps have saved more lives. So these are things that in some cases you plan for, in some cases you just hope that you're able to negotiate the type of access and get the right partners and get the right funding and the assets in place.
Could you tell us a little bit about some of the challenges moving forward after you obtain some access?
Sure. We were able to negotiate access, not just for the DART teams and for the UN, but for our non-government organizations. And we were able to get a lot of new NGOs that had never operated in Burma prior to this. So it opened up an opportunity for international assistance. But the key here as well is that we learned going into Burma that there was a large response by the civil society, which was wonderful. The Burmese themselves took it upon their own responsibility, regardless of what the government was telling them, to go in and save lives. So you had all of these operations and private resources that were going in there. And the unfortunate reality is that once the conditions stabilize, then the government again started shutting down operations because what they were willing to do was allow humanitarian assistance and humanitarian operations. But they viewed long-term stabilization activities and early recovery efforts as development. And they viewed development as perhaps the international community and others coming in and engaging in civil society rebuilding efforts in terms of promoting perhaps democracy and open access and transparency. And that's the unfortunate reality is that, yes, we were able to negotiate access for emergency response. It was somewhat of a delay, but I would say that given the challenge that we had where we didn't have open access, where we didn't have partners, we were able to save lives. We were able to create stabilization. But if you look at the situation here, I mean, in Burma, 2 years to 3 years after the fact, there's a large amount of the population in the Delta region that still do not have the homes, do not have the tools, do not have the jobs, do not have the necessary support in order to fully rebuild their lives. And there's perhaps a generation lost here. And these are things that more often than not you look at and you say, well, humanitarian assistance in emergency response is not the solution. It really is a Band-Aid. It really is a short-term relief effort. The key is a political development issue. So I think in order to get governments to understand that development and early recovery activities are not politically motivated, that it is born out of humanitarian imperative, and that humanitarian response does not end just because people may not be dying due to high mortality, low nutrition. But what do you do when there's inadequate nutrition? What do you do when there's inadequate resources for early recovery and transition? Then you basically have a large population that were vulnerable, that were impacted by a disaster, that will continue to be vulnerable, and it's a real missed opportunity, and it does affect the future generation of that population.
This differentiation between relief or humanitarian assistance and development seems to also there seems to be a dichotomy even in the United Nations and in the U.S. Mm-hmm. Is there a more fundamental change or in different ways that we can address this dichotomy?
Mm-hmm. There shouldn't be. And I think that the emergency relief agencies, the development agencies are both at fault. When we use language like this is an emergency response, when we use language this is a relief effort, or this is a development effort, then all of a sudden you conjure up different approaches, different indicators in terms of response. So then you have a debate. When does the emergency response end? When does transition activities take place? When does development activities take place? For me personally, it is a development issue. In order for us within this community to promote and enhance development activities in countries that are emerging or in transition, when you have vulnerable populations, whether there is a large internally displaced population or high risk related to drought, to famine, when you have countries that do not have the resources and a small incident can result in large vulnerability, these are development issues. And my point here would be that we can learn from each other, the response agencies and the development agencies. I would say that to date, I think the emergency agencies have done a very good job of reaching out to development actors. You hear non-government organizations who are engaged in development, in emergency relief, use development language. They're talking about transitions. They're talking about longer-term engagement, and then they're putting their emergency and humanitarian programs in the longer context of development assistance. Unfortunately, when you speak with development actors, I don't see that same level of engagement, and that's where I think that there's still a lot to do, whereby academic institutions and other research entities and perhaps the same non-government organizations that are working at the same field level with development actors need to be able to have a kind of a whole response where from the beginning of a catastrophic event that there are joint assessments. These things are somewhat taking place. I just came out of Haiti where I came in on behalf of Tulane University to look at coordination, to look at mass casualty management there. And going into the meetings, I think everybody now is talking about, okay, we need to focus on long-term recovery. And there is the PDNA assessment that's taking place. However, I think people are almost going through the motions. People say, yes, let's think now immediately about long-term recovery. But where are the resources for long-term recovery? Nobody's talking about what the donors are going to be doing. The short-term emergency rapid response by UN OCHA and others, that assessment still hasn't come into place. And yet the PDNA, which is looking at long-term recovery, is now taking off. So there's a duplication potentially of efforts here, because you can't have a development tool looking at assessment that has to be built upon what the short-term emergency response is in order to make adequate allocation of resources take place. So there is this rush now, I think, for early recovery and long-term development to take place, but people are doing it, again, based upon their own mandates, based upon their own perception, and that connectivity, that coordination that has to take place between emergency, care and maintenance actors and development actors, that is not taking place to the point where you're going to have effective use of resources. And that's my concern right now, that there is a recognition that there are no systems in place to make sure that it's effective.
So is this a systematic problem? As you said, no systems in place. Is this a fault of the UN cluster approach, or is it a lack of awareness of donors that the money is required in longer term? What might be the contributing factors to this problem?
It's all of the above. And for us at Tulane, we feel that this is a leadership issue. You know, I can say that when I was at OFDA, one of the biggest issues I was trying to address was weak leadership within humanitarian coordinators within the UN system. Within that system, more often than not, the humanitarian coordinators come out of the UNDP, the resident coordinators, and they're approaching it again from a development aspect, where the reality is that sometimes difficult activities, engagement with countries who may not necessarily be very humanitarian or very open with regard to allowing access, humanitarian coordinators need to come in and have that level of engagement. And sometimes, the development actors come in. Their job really is to work with their counterparts in the government. So that ability to be able to criticize, to be able to champion the humanitarian community didn't exist within the UN cluster approach. And the level of investment in terms of making sure that humanitarian coordinators who are deployed understand what the realities are at the field level and can defend and support and champion this, I think there's a long way to go. And donors need to put more money in terms of training and education for humanitarian coordinators. And I think the UN has to stop paying lip service in terms of leadership with regard to their staff and actually look at making the investment in terms of training. And this is not short term. This is about changing approach. This is about changing the next generation of leaders, and that requires long-term investment in resources.
So you clearly approach this from this leadership aspect, and you were at the head of this, the leadership, let me see, the leadership resilience.
It's the Disaster Resilience Leadership Academy.
Thank you. Mm-hmm. Is that the critical factor to get this off the ground?
Yes. The reason that we established the academy is that you look at the humanitarian landscape, where there are 26 million internally displaced persons because of conflict. There's 77 million IDPs altogether. There's 12 million refugees. Each year, things are deteriorating. If you look at forecasts for climate change, they're saying potentially there's going to be 100 million IDPs because of climate change. There are more resources going into humanitarian operations. Each year, donors are putting more money in there. The technically trained staff that are deployed, yes, there's a proliferation of graduate degrees that are turning out great experts with regard to water sanitation, public health, logistics. There are systems in place in terms of this. But we're not getting the impact that one would expect with additional resources, with additional technical enhancement. And what it comes down to is leadership. What it comes down to is that the frontline managers who have to make the difficult decisions, the donors who have to allocate resources between what goes into an emergency phase, what goes into care and maintenance, and what goes into development, that's the key here. And for us, within Disaster Resilience Leadership Academy, we are targeting mid to senior level managers who already have a wealth of experience in terms of operations to come in and take a systematic approach to building their leadership skills so that when they go back to their job, they're able to more effectively champion and to more effectively be able to make those difficult decisions, those life and death decisions that aren't easy. They're not based necessarily upon a roadmap or a plan. Because as we all know in disasters, one day to the next, 1 minute to the next, things change. And how do you make that effective decision? How do you be able to lead your programs? How do you be able to coordinate and bring your peers to the table so that you ultimately have a positive impact with limited resources with increasing risk every year?
I was interested in when you worked at the OFDA, you implemented change.
Right.
Could you tell a little bit about that process, that leadership role, and the aspect of leadership training that you're trying to implement in the people that go through the academy?
As the head of OFDA, I manage OFDA staff. As part of OFDA and part of the U.S. government, I have peers within the Food for Peace, with the Office Transition Initiative, with USAID missions. And obviously, I had my bosses within the White House and the National Security Council and the State Department. To initiate change, it requires one to be able to work within your own mandate. That meant that as I wanted OFDA to look at transitions and early recovery and understand that we were not just an emergency response agency, first it took changing the perception within OFDA staff. Second, once that was done, to take that new initiative to my peers within Food for Peace, within the Office Transition Initiative, within the USAID missions at the field level, to be able to say, okay, this is what we do now, but we cannot do this alone. We have to have your partnership, we have to have your buy-in. And finally, what it comes down to is resources and mandate change. It means that the people I reported to, the Secretary of State, the National Security Advisors, and others also had to understand that if there was a disaster declaration in place, resource management, what that meant in terms of programming, they had to also be on board. That meant that taking all of this upwards. To ultimately make sure that any sort of initiative that results in positive change, you have to have buy-in from within, across the board, and obviously upwards.
And you have talked about how working with your partners is important in addressing preparedness issues and in addressing response. Can you tell us a little bit about the impact of this preparedness? How does it compare to actual response, and how effective or not it is?
Right. It's the key. Everybody talks about it, right? We have the statistics in place. Every dollar put into preparedness, you save $4. Again, ultimately, what you put into that saves lives. And I'll use for an example here, the hurricanes, the back-to-back hurricanes that hit Haiti back in 08, 09, where prior to that, similarly in Guanaive, there was a hurricane that went through that resulted in large amounts of deaths. I mean, we're talking about upwards of 50,000 people that perished. However, the hurricanes that went through in 09 did not result in the same because of early warning investments that were promoted in terms of education and preparedness activities on the part of the partners. So we saw there that a similar Cat 4, Cat 5 that goes through saved lives and obviously had that intended impact. That's a great lesson to be learned. Unfortunately, as much as we promote that, it means changing the way that we allocate our resources. And when a disaster hits, everybody rushes in. Everybody feels compelled to be able to put money on the table. Everybody wants to be part of that. But when conditions stabilize and the cameras are no longer there, the donors aren't at the table. The goodwill of corporations and others focus on the next disaster. And this very vulnerable population that still needs assistance isn't there. And when you try to engage donors and corporate donors about putting money into preparedness activities, it is very difficult to do that. So yes, I think that there are real successes in terms of preparedness activities. I think partners understand this. The road ahead here is to make sure that there are leaders that we have in place that make those decisions about where resources are allocated, understand and make that difficult decision to put money in preparedness that may not be visible, that may not result in the same exposure, but we all know that it saves lives in the long run.
This is a very challenging work, right? So you work in humanitarian logistics, which it's full of challenges, uncertain demand, uncertain supplies, conditions on the ground that are unknown. And why do you do it at a personal level?
At a personal level, because it inspires me. I mean, the reality is that most of the people who do this work, they do it because they learn something from the beneficiaries. They learn something from their counterparts. When you deploy into a situation, yes, you come in and you want to save lives, you want to provide assistance, you want to alleviate suffering. But you gain so much from the resilience of your counterparts. Whether you're talking about the situation in Darfur, where women and children walk for miles from one village to the next that have been burned down, they find a way to survive. When you go into camps and you look at how people live, and you just think to yourself, how could you do that day in and day out? How could you raise your children in such a setting with limited resources when you know that perhaps from your perspective the future is bleak? But the people you meet, they smile, they talk about their future, they talk about rebuilding, they talk about their children. And that to me inspires me, and that is what keeps me going, because I have 2 young children, and I hope that I have the same strength that many of the people who faced catastrophic events, whether it's natural or man-made, their ability to be able to take care of themselves, take care of their family, and look towards the future, that inspires me, and that's why I do what I do.